Welcome to this informative video about Eales disease, a rare but potentially vision-threatening condition affecting the eyes. In this video, we will explore its causes, symptoms, diagnosis, and management, shedding light on this often misunderstood disease. The exact cause of Eales disease remains elusive, making it a challenge for researchers. However, it is believed to be multifactorial, involving a combination of genetic predisposition, inflammatory processes, and abnormal blood vessel growth. Some studies have suggested a possible link to tuberculosis infection, although this is not definitively proven. Further research is needed to fully understand the underlying causes of this complex disease. Eales disease is characterized by a three-stage pathological process. Initially, the peripheral retinal blood vessels become inflamed, a condition called peripheral retinal vasculitis. This inflammation weakens the vessel walls. In the second stage, these weakened vessels become occluded, or blocked, depriving the peripheral retina of oxygen. This leads to retinal ischemia. In response to the ischemia, the retina releases growth factors, such as vascular endothelial growth factor, or VEGF, which stimulate the growth of new, but abnormal blood vessels, a process called neovascularization. These new vessels are fragile and prone to bleeding, causing vitreous hemorrhages and ultimately leading to retinal damage and vision loss. Eales disease is a relatively rare condition, with a higher prevalence in young adults, predominantly males between the ages of 20 and 40. While it can occur worldwide, it is more commonly observed in certain populations, particularly in India and other parts of South Asia. Due to its rarity, precise epidemiological data is limited, highlighting the need for more comprehensive studies to determine its true global incidence and prevalence. The signs and symptoms of Eales disease can vary depending on the stage and severity of the condition. In the early stages, some individuals may experience no noticeable symptoms. However, as the disease progresses, common symptoms include blurred vision floaters, which are dark spots or strands that appear to drift across the field of vision, and sudden vision loss due to vitreous hemorrhage. In severe cases, retinal detachment and neovascular glaucoma can occur, leading to significant and irreversible vision impairment. Diagnosing Eales disease requires a comprehensive eye examination, including a dilated fundus examination to visualize the retina and its blood vessels. Fluorescein angiography is a crucial diagnostic tool, involving the injection of a dye into the bloodstream, which allows the ophthalmologist to visualize the retinal blood vessels and identify areas of inflammation, occlusion, and neovascularization. Optical coherence tomography, or OCT, can also be used to assess the retinal structure and detect complications such as macular edema or retinal detachment. Because of possible association with tuberculosis, patients are often tested to rule out this disease. While there aren't strict types of Eales disease, it is often classified based on the stage of progression and the severity of the vascular changes. This staging helps guide treatment decisions and predict the potential for vision loss. Early stages typically involve peripheral retinal vasculitis, while later stages are characterized by neovascularization, vitreous hemorrhage, and retinal detachment. The treatment of Eales disease aims to control inflammation, prevent neovascularization, and manage complications. Corticosteroids may be used to reduce inflammation in the early stages. Laser photocoagulation is a common treatment for neovascularization, involving the use of a laser to destroy the abnormal blood vessels and prevent further bleeding. Anti-VEGF injections, such as bevacizumab or ranibizumab, can also be used to inhibit the growth of new blood vessels. In cases of vitreous hemorrhage, vitrectomy surgery may be necessary to remove the blood and clear the visual axis. For retinal detachment, surgical repair is often required to restore vision. Currently, there is no known way to definitively prevent Eales disease, given the uncertainty surrounding its exact cause. However, maintaining a healthy lifestyle, managing underlying health conditions, and avoiding potential risk factors such as smoking may help reduce the risk of developing the disease or slow its progression. Early detection and prompt treatment are crucial for preserving vision and preventing long-term complications. Regular eye examinations are highly recommended, especially for individuals with a family history of the disease or those belonging to high-risk populations. The prognosis for Eales disease varies depending on the stage of the disease at diagnosis and the effectiveness of treatment. With early detection and appropriate management, many individuals can maintain useful vision. However, if left untreated, Eales disease can lead to significant vision loss and blindness. Recent research has focused on identifying genetic markers and developing more targeted therapies for the disease. Studies are also exploring the potential role of anti-inflammatory agents and immunomodulatory therapies in preventing disease progression. Ongoing research offers hope for improved treatments and a better prognosis for individuals affected by this challenging condition.